close your eyes. Now imagine this. You're lying on a rough wooden table. There's no light, just the flicker of a lantern. You're surrounded by the scent of rotting flesh, alcohol, and blood. And the man standing above you, he's not wearing gloves. He's not washing his tools. He's sharpening a saw, the kind used for cutting wood, because in a few seconds, that saw is going through your leg. Welcome to surgery in the 18th century. Tonight, we're stepping into a forgotten corner of medical history, a time when doctors didn't cure, they just tried to keep you alive, a time when surgeons were seen more as butchers than healers, a time when pain was inevitable and survival was optional. There were no anesthetics, no sterilized instruments, no understanding of germs, infection, or internal bleeding. And yet, people still lined up, desperate to be cut open, because the alternative was often worse. And leading us through this journey is a man named Peter Hugeford. He was a real person, born around 1725, trained in England, and later moved to colonial New York. He was a loyalist, a husband, a father of 12, and most importantly, a surgeon, one who saw the very worst of war, disease, and death, and somehow kept picking up the knife. You've probably never heard his name before, but by the end of this video, you won't forget him. In this slow, sleep-friendly documentary, we'll explore what life was really like for a surgeon in the 18th century. We'll walk you through the day-to-day horrors of operating rooms. We'll open up the toolbox of an 18th century surgeon. From blood-stained knives to bone saws, you'll learn how real doctors had to compete with dangerous street peddlers, selling poisons disguised as miracle cures, and how medicine was often more of a gamble than a science. We'll follow Peter Hugeford across war-torn America, from prisons to battlefield tents to the frost-bitten streets of Nova Scotia. We'll witness his rise, his fall, and his quiet, painful end. And along the way, you'll discover the horrifying realities of surgical practice before anesthesia, before antibiotics, before the word doctor meant hope. This isn't just history. It's the kind of truth that makes you grateful to be alive today. So why should you watch till the very end? Because this story is full of forgotten details, real human suffering, and unbelievable resilience. Because you'll come to understand not just how medicine evolved, but how people endured in a world that offered them so little comfort. And by the time this video ends, you'll know the answer to a simple question. Why did it suck, truly suck, to be a surgeon in the 18th century? So grab a blanket, turn down the lights, and let this quiet, terrible tale lull you into a deeper understanding of the past. Or maybe just sleep. Welcome to Restless Historian, where boring history gets the respect it deserves. If you enjoy this kind of slow, strange storytelling, don't forget to subscribe, hit the like button, and let us know what forgotten tale we should tell next. Now, let's begin. Before we talk about the horror of 18th century surgery, we need to meet one of its quietest players. His name was Peter Hugeford. He wasn't famous. He didn't invent anything. There are no statues in his honor. But the life he lived says more about early medicine than most textbooks ever will. Peter was born around the year 1725, somewhere in England. There are no birth certificates, no childhood letters, only silence. That, and what he left behind. We don't know who raised him. We don't know what drew him to medicine, but at some point, young Peter must have stood in a room and watched someone cut open a body, and something inside him must have said, I could do that. He likely trained as an apprentice, which was the only real way to become a surgeon at the time. You didn't go to university. You didn't get a degree. You studied under a practicing surgeon, watched him cut, handed him tools, mopped up blood, and, if you were lucky, eventually did the cutting yourself. By the time Peter was in his early 20s, he made a bold decision. He left England. In 1745, Peter boarded a ship and crossed the Atlantic Ocean. He was heading for Westchester County, New York, a place of forests, rivers, and tension between colonial settlers and native land. He was barely 20 years old, and he was about to start over. He didn't arrive alone for long. Within a few years of settling in New York, Peter married a woman named Elizabeth. She was born in 1730. She would become the mother of 12 children. Yes, 12. This wasn't uncommon for the time. Large families were needed to survive the harshness of colonial life. But surviving was another story. Not all 12 children made it to adulthood, of course, but 4 of them left lasting footprints in the historical record. Martha, who would go on to marry Elias Hardy, a prominent loyalist in New Brunswick. Jane, who married Tertullus Dickinson, another loyalist. John, born in 1750, who became a doctor like his father, and Peter Jr., born in 1766, who also chose medicine and died young in 1795. There's something quiet and impressive about this family. They weren't loud. They didn't make headlines. But they moved through history like ghosts. Through war, through loss, through exile. Always loyal, always surviving. And that loyalty wasn't just a family trait. It was Peter's defining characteristic. From the beginning, Peter Huggford was fiercely loyal to the British Crown. That might not seem unusual. After all, he was born in England. But in the colonies, especially in New York, loyalty could get you killed. By the mid-1700s, tension between Britain and its American colonies was building fast. Taxation, representation, rebellion, words that stirred anger in taverns and homes. But Peter didn't switch sides, even as neighbors chose to fight for independence. Even as the American Revolution crept closer, Peter remained loyal to Britain, quietly, steadily, even when it cost him everything. But we'll come to that part later. For now, Peter was building a life in Westchester, a husband, a father, and most importantly, a surgeon. Now, we need to pause here for a moment, because the word surgeon in the 18th century didn't mean what it means today. Surgeons back then were considered manual laborers. They worked with their hands. They didn't write prescriptions or debate philosophy. They cut things open. They removed limbs. They stitched gaping wounds. And they did it fast, because they had to. Surgery, even in the best conditions, was dangerous. But in the colonies, it was brutal. There were no proper hospitals. There were no sterilization practices. Instruments were used on one patient, then another, and another, often without even being wiped down. The typical surgeon's kit included a bone saw, a scalpel, forceps, and thread. Nothing was sharp enough, nothing was clean enough, and the only pain relief was a shot of rum or biting down on leather. But Peter was willing to do it. He opened a private practice in Westchester County, New York. We don't know how big it was. We don't know how much he earned, but we know he specialized in surgery, and for that, he would have been called when others ran away. If someone was shot, call Hugford. If someone broke a leg falling off a horse, call Hugford. If someone's arm turned black and swollen from infection, well, there wasn't much to do, but Hugford would come, saw in hand. In a way, surgery was the only option. There were no antibiotics, no real treatments for internal illness. If something was visibly wrong, a tumor, a wound, a shattered bone, the only hope was to remove it. Peter Hugford, standing in blood-stained aprons, likely performed dozens, if not hundreds, of these procedures. Each one a gamble, each one a prayer. He wasn't a miracle worker, but he was brave. In a time when opening the human body was barely understood, Peter did it anyway. He did it for strangers. He did it for soldiers. And later, when war came crashing through his front door, he did it for survival. But that's a story for another chapter. Before we talk about the surgeons themselves, let's understand what surgery really meant in the 18th century, because it wasn't what we imagine today. No operating rooms, no bright lights, no clean gloves or gentle voices. Surgery was a last resort, a desperate act, done in haste, done in pain, no matter how skilled the surgeon. Every single cut carried a very real risk: pain, infection, or death. There were no anesthetics. There was no sterilization. No one wore masks. No one washed hands between patients. The most a patient could hope for was a shot of strong liquor, maybe a bit of opium if it was available. But usually, all they got was something to bite down on, and someone to hold them down. Now imagine that. Imagine lying on a table. Your leg is infected, black and rotting. There's no saving it. And the surgeon, like Peter Hugford, leans in and says, "Hold still." And then he begins. No countdown, no sedative, just the brutal work of cutting through skin, muscle, and bone. The tools of the trade were basic. Most surgeons carried a leather roll or wooden box. Inside, you'd find a bone saw, wide-bladed, strong, used to cut through limbs, amputation knives, long, curved blades for slicing flesh fast, forceps for gripping arteries or removing, bullets, probes and scissors for poking and snipping deep tissue, and needle and thread for stitching the wound closed, if the patient made it that far. These tools weren't cleaned between surgeries. A surgeon might wipe his knife on an apron and move to the next case. Infection wasn't understood. Germs weren't even a theory yet. Blood covered everything. It dripped onto the floor, soaked through clothes. Surgeons were often recognized by their stained aprons, badges of experience. In fact, the phrase operating theater came from the practice of watching surgeries like performances. Some were public, others were for students. People gathered around to watch, not with horror, but fascination. But make no mistake, this was still a world where most patients died. The pain was unimaginable, and the danger wasn't over when the surgery ended. It had only just begun, because even if you survived the cut, infection was waiting. In an age with no antibiotics, even a small wound could turn deadly. Terms like hospital gangrene or blood poisoning were common. Sometimes wounds oozed green or black. Other times, they closed too early, trapping pus and bacteria inside. A surgeon might drain the wound or try to bleed the patient, but often they simply watched as the fever rose and the patient slipped away. One surgeon of the time, William Hunter, once described the profession this way: a savage, armed with a knife. He wasn't exaggerating. Even trained professionals worked in conditions that felt more like war zones than healing centers. Old surgical manuals from the 1700s give us a haunting glimpse into this world. They spoke in plain, chilling terms. One entry reads, "Take a firm hold of the limb. With the first stroke, divide the skin and muscle down to the bone. Use the saw quickly and steadily. The less time the patient is under the knife, the better." Speed was everything. A good amputation took less than 2 minutes. Some surgeons prided themselves on being able to remove a leg in under 60 seconds. It wasn't about precision. It was about survival. Let's talk about the most common operations done during this time. Amputations, by far the most frequent in war, in accidents, in infections. Limbs had to come off. It was brutal, messy, and horribly painful. Tourniquets were tied to stop the bleeding. Muscle was sliced with a curved knife. Bone was sawed clean through. Then the wound was either cauterized with hot irons or closed with coarse thread. Most patients screamed. Some passed out. Many never woke up again. Bullet removal. Times of war, bullet wounds were common. If a musket ball stayed inside the body, it had to be pulled out. Surgeons would dig deep into the wound with forceps or hooks. No antiseptic, no x-rays, just guesswork. Sometimes they got the bullet. Other times they went too deep and caused more damage. Setting broken bones, not all surgery, involved cutting. Broken limbs needed to be realigned by hand. The process was slow, painful, and often incorrect. Bones healed crooked. People limped for life, but at least they lived. Lancing abscesses and tumors. If a patient had a large swelling or lump, the only option was to slice it open. A long, careful cut was made. Pus drained out. Sometimes it relieved pressure. Other times, it led to sepsis, a full-body infection that killed silently. Trepanation, skull drilling, one of the most shocking surgeries of the time. Surgeons drilled holes into a person's skull to relieve pressure or treat head injuries without anesthesia, without understanding brain anatomy. Some people survived, many did not. Now, imagine being the person on the table. No one explained the risks. No one discussed the outcome. You were told, it's this or death, and you nodded. That was the reality. There were no hospital beds with clean white sheets. Most surgeries took place in homes, kitchens, barns, tents on battlefields, anywhere with enough light and a flat surface. Sometimes other patients watched from the side. Other times, neighbors were brought in to help hold a patient still. It was a community effort, soaked in blood and silence. Surgeons like Peter Huggiford weren't glorified. They weren't trusted automatically. They had to prove themselves, not through degrees, but through action. One clean cut, one more life saved, one more day earned. That's all they had to offer. And somehow, despite all this, people kept coming back because even in the most terrifying conditions, surgery gave people hope. It was terrifying, yes, but it was also a chance to live. And for some, that was enough. Before we talk about the patients again, let's take a moment to understand the surgeons themselves. We often imagine them as calm professionals, people with steady hands and strong hearts. But in the 18th century, things were different, very different. These were not doctors in clean white coats. They were men who spent their days cutting into people who were awake, screaming, begging, sometimes dying. Right there, on the table, there was no emotional training, no guide on how to handle trauma, no therapy, no support. A surgeon might perform 3 or 4 amputations in a row, and then go home and sit quietly at dinner while the sounds of saws and screams echoed in his mind. Some broke down completely. Some quit the profession. Some turned to drink or became distant, detached. Because if you didn't, if you stayed soft, you didn't last. The great historian René Fulop Miller once said, "There is hardly a medical practitioner of earlier centuries who was not deeply and permanently affected by the psychological damage inflicted through the practice of his art." Surgeons lived with the constant memory of pain, not just their patients, but their own. Imagine seeing children brought in for surgery, wounded soldiers, mothers with mangled arms, and knowing that you, the one holding the knife, were about to give them the worst pain of their life. And if they died, you had to keep going. There was no space to mourn, no time to feel. The mental toll was enormous, but it wasn't something anyone talked about. There was no language for trauma or mental health. So, many surgeons did the only thing they could. They hardened. Some became emotionally numb. They moved through their work like machines. Quick cuts, fast stitches, no small talk. Others went cold, even cruel. They began to see pain as routine, a natural part of the job, not something to fear, just something to manage. It wasn't that they didn't care. It's that caring made it worse. A few even grew proud of their detachment. They saw it as strength, proof that they could survive in a profession most couldn't handle. But inside, many were haunted. Letters from surgeons of the time sometimes mention nightmares, strange moods, an inability to sleep. Some describe breaking down in private. Others admit they began to see every person as a potential body on a table. It wasn't just about blood or guts. It was about the weight of decision-making. Every patient's life was in their hands, and they knew it. They were also alone. Unlike today, where doctors consult, collaborate, and refer. Most 18th century surgeons worked by themselves. If something went wrong, the blame was theirs. And the guilt, too. Even the best surgeons lost people, and every loss stayed with them, especially when it was someone young, someone they knew, someone who cried out for help and didn't make it through. And yet, they kept going, because there were always more patients, always more suffering, always another knock at the door. Some wrote about it, some prayed, others simply buried it. They didn't talk about the smell of gangrene, or the trembling hands of a boy about to lose his leg. They just carried on, not because they were unfeeling, but because they had to be. For surgeons like Peter Hugeford, the 18th century wasn't just about science. It was about survival, both physical and emotional. They lived between two worlds, one of healing and one of pain. And over time, that did something to them. Before we talk about Peter Hugeford's life in New Brunswick, we need to travel back to a time when the American colonies were in flames. It was the year 1775, the start of the American Revolutionary War. The streets were tense. Neighbors were turning against neighbors. Loyalty became a dangerous thing. And Peter Hugeford was loyal, not to the colonies, but to the British Crown. This was not a quiet opinion. He was outspoken. He supported King George III. He stood by British law, and in Westchester County, New York. That was enough to make him a target. The locals saw him as a traitor, a man standing in the way of freedom, and eventually, it caught up with him. He was arrested, dragged from his home and thrown in a makeshift jail in Poughkeepsie. Not a cell with bars, but a house under guard. No formal trial, no legal process, just suspicion and punishment. But Hugeford wasn't a man who sat still. He planned his escape, under the cover of night, or perhaps in broad daylight with the right distractions. We don't know exactly how. He fled Poughkeepsie, and he didn't just run. He returned to British lines, slipping across dangerous territory until he reached the safety of the King's forces. There, his loyalty was rewarded. He was appointed surgeon to the Loyal American Regiment. That meant he now had a new battlefield, not a quiet home or a village clinic, but war, real war. The Loyal American Regiment fought on the side of the British during the Revolution, and Hugeford went with them, into the mud, the trees, the gunfire. Battlefield surgery in the 18th century was one of the darkest kinds of medicine. There were no tents with clean beds, no stretchers carried by trained medics. Wounded soldiers were often dragged behind walls, into barns, or beneath trees. And there, Hugeford would get to work. A man with a shattered thigh from a musket ball? He'd need amputation. Quick, brutal, and without pain relief. A soldier with a bayonet wound in the belly. There was little hope. Most of the time, Hugeford could only ease the death. The tools were always the same: bone saws, knives, needles, and strong hands. There were no gloves, no sterilizers, no understanding of germs. Every cut was a gamble. Every operation carried the risk of infection, shock, or death. The sounds of the battlefield were one thing, the muskets, the cannons, but the cries of the wounded behind, the lines, those stayed with surgeons like Hugeford forever. Men with blood-soaked bandages, limbs turning black from gangrene, the fever of sepsis burning through their bodies, and all Huggiford had to fight it were a few herbal tinctures, some wine or rum, and steady hands. This wasn't the medicine of textbooks. It was medicine in its rawest form, desperate, loud, and chaotic. And while Huggiford worked to save lives, at the front, his family was suffering behind it. Back in Westchester, the war had turned personal. Anyone seen as a loyalist faced threats, violence, and property seizures. Huggiford's wife, Elizabeth, and their 12 children were not safe. With her husband gone, arrested, escaped, and now with the British Army, Elizabeth had to make a choice: stay and risk being overrun, or flee. So she gathered the children, some still very young, and they made their own escape to New York City. But the journey wasn't easy. They arrived in distress, as the records say. That likely meant hunger, no money, nowhere to live, just a city packed with refugees, loyalist families, and wounded soldiers. Elizabeth had to care for her children alone. And Huggiford? He was still at war. There's no record of when exactly they reunited, but we know the family stayed in New York until the war ended. The Huggifords were among thousands of loyalists who sacrificed everything: homes, friends, peace, to remain loyal to the British Crown. For Peter Huggiford, these years weren't just about medicine. They were about survival, principles, and loyalty. And his story was far from over. Before we talk about how Peter Huggiford lived out the rest of his days in New Brunswick, we need to look at the strange and dangerous world he had to practice medicine in, because being a surgeon in the late 1700s didn't just mean fighting infection or setting bones. It meant fighting for trust. And that trust was under constant attack, not by war, but by the wild rise of patent medicines. This was the age of brightly labeled bottles, of fancy names, and even fancier promises, of powders, potions, elixirs, and pills, all claiming to cure just about everything, and none of it regulated, none of it tested, none of it safe. Walk into a shop in St. John, New Brunswick, say a Dino Paddock's medical store on King Street, and you'd see shelves lined with these so-called cures: Dr. James's powder, Turlington's balsam of life, Daffy's elixir, Godfrey's cordial, Hooper's female pills, each with its own story, each with its own set of dangers. Take Dr. James's powder, for instance. Originally created by an English doctor named Robert James, this powder was a household name. It claimed to treat fevers, gout, even scurvy. But what was actually in it? Mostly antimony and calcium phosphate. Sounds harmless? Think again. Antimony is toxic. It causes vomiting, diarrhea, respiratory damage, and skin eruptions. In some cases, it led to death. Yet it was sold with confidence as a cure-all, and people believed in it because it came in a fancy box, because it had a doctor's name on it, because it was old and familiar. But not everything was subtle. Next on the shelf, you'd find Turlington's balsam of life. With a name like that, you'd think it could cure anything, and that's exactly what it claimed to do. Stomach pain, kidney stones, coughing fits, even paralysis. Its secret? A dangerous mix of essential oils and ammonia. Yes, ammonia, a chemical that, when inhaled or swallowed, can burn the throat, destroy the lungs, and in high enough doses, kill. This was not medicine. This was poison. But that didn't stop people from buying it, because it was easier to believe in a bottle than to find a real doctor, and not all the damage was done to adults. One of the most infamous remedies of the era was Godfrey's cordial, also known as Mother's Friend. It was marketed as a soothing syrup, perfect for crying babies, colicky toddlers, or fussy children. Just a spoonful, and your child would sleep peacefully. But here's the horrifying truth. Godfrey's cordial contained opium, 1 grain of opium for every 2 ounces. That's a lethal dose for infants, and many, many children died because of it. Some nurses even used it intentionally to keep children quiet, to make their job easier. It didn't take much, just a bit too much of the syrup, and the child would slip into a deep sleep they'd never wake up from. Mothers trusted the cordial. They thought it was gentle, but it was deadly. And while children were dying from medicine, women were being sold something else entirely. Hooper's female pills. These pills promised to fix what the ads called female troubles: giddiness, sinking spirits, a sad face, not wanting to talk or move. In other words, depression, anxiety, exhaustion, all of it seen as a personal flaw, something to be corrected. The pills themselves were just high doses of iron, ferrous sulfate, ferrous carbonate, enough to cause constipation, nausea, and in some cases, iron toxicity. But they were popular. Why? Because they promised to make women normal again, to make them cheerful, polite, productive. That was the point. Fix the behavior, ignore the cause. All of these remedies, Dr. James's, Daffy's, Godfrey's, Hooper's, came from a world more interested in profit than in healing. And yet, they sold everywhere. Early newspapers in New Brunswick, like the Royal Gazette, were packed with ads for these products. Even respectable doctors, like Adino Paddock, a man with real training, sold them in his store. Why? Because patients expected them, because they made money, and because the line between medicine and marketing was so badly blurred, even professionals gave in. Real doctors, like Peter Huggiford, had to compete with quacks and peddlers, men with no training, just a wagon full of bottles and a story. To sell, there were Jesuits' drops, supposed to cure venereal disease, German corn plaisters for foot pain, pectoral pills for coughs, and vermifuge lozenges to get rid of worms. Some of them worked a little, most did nothing, and a few were outright killers. But they all had something in common. They were marketed with confidence. In that world, confidence was more powerful than knowledge, more valuable than ethics, more trusted than science. And that was the battle real surgeons had to fight. Not just disease and injury, but belief. Before we talk about Peter Huggiford's quiet retirement in the New Brunswick, we need to understand what he went through after the war, not as a surgeon, but as a father and a man struggling to survive, because the war ended, but his troubles didn't. Peter Huggiford had served faithfully. He had treated wounded men in field tents and smoky barns. He had risked his life behind enemy lines. He had lost his home, his freedom, his safety, all in the name of the crown. But loyalty didn't pay the bills. And when peace finally came to the colonies, Hugeford, like so many other loyalists, found himself cast aside. There was no grand reward, no fortune, not even a decent salary. He was owed money by the British Army, payments for his service, supplies, and work. But the money came late, if at all. His letters from this period tell the story best. In one, he writes of being unable to buy firewood for his family. In another, he describes his children in rags, 12 children, and no stable income. While others celebrated the birth of a new nation, Hugeford could barely afford bread. And it wasn't just the money. There was also the shame, the bitterness of being forgotten. He had served in the loyal American regiment with skill and courage. But now, in the crowded streets of New York City, he was just another displaced loyalist. Thousands had fled to the city for protection during the war. Now they were trapped, packed into tiny rooms, waiting for ships to take them elsewhere, anywhere. Hugeford and his wife Elizabeth did what they could. They borrowed, they pleaded, they hoped, but it wasn't enough. With the war over and the British withdrawing, loyalists had two choices: stay and risk retaliation from neighbors who now viewed them as traitors, or leave and start from scratch in a place they'd never seen. Hugeford knew he had no future in the new United States. So he set his sights on Britain, not to live there, but to be heard. He petitioned the British government directly. He filed a formal claim for compensation, detailing the losses he'd suffered: property destroyed, income lost, supplies never reimbursed. The government reviewed his service, they examined his case, and finally, a small victory came. They granted him a pension, a modest one, but enough to help. The process took time. There were delays, bureaucratic letters, and repeated appeals. But Hugeford didn't give up. He was proud of his work, proud of his loyalty, and determined to leave something for his family, even if it wasn't much. The pension helped him resettle. It allowed him to move north with Elizabeth and the children to New Brunswick, where many other loyalists were beginning new lives. But the years in New York had taken their toll. Peter was older now, tired, weakened. The war had aged him, not just in body, but in spirit. Still, he kept working, treating patients, using what little supplies he had left, and teaching his children what he knew, because medicine, for him, had always been more than a job. It was survival. It was purpose. Before we talk about the final chapter of Peter Hugeford's life, we need to travel with him to a quiet corner of what was then British North America, a small loyalist town called Digby in Nova Scotia. It wasn't much. No great cities, no bustling hospitals, just a cluster of new homes built by families who had lost everything. Digby was a settlement of survivors, loyalists who had fled war, persecution, and poverty. They brought with them their memories, their hardships, and in some cases, their doctors. Peter Hugeford arrived in Nova Scotia sometime after 1783. By then, he was in his late 50s, worn down by years of field surgery, personal loss, and constant uncertainty. But he wasn't finished. Instead of retiring comfortably, he started again, quietly, with little recognition, as a local physician in Digby. There were no marble plaques, no grand announcement, just a man with a kit of worn tools, knocking on doors, offering help to whoever needed it. Many of those doors belonged to the poor, families who had nothing but their health. And when they lost that too, Hugeford was often the only one who came. He treated settlers for infections, injuries, fevers, and childbirth complications. And he did it not for profit, because there was little money to be made, but because someone had to. Over time, his role became known not for brilliance, but for devotion. One account described him as unselfish and largely unrewarded. He wasn't flashy. He didn't publish books or claim new cures. But in a town where even basic care was rare, his presence meant everything. Word of his service reached the Anglican clergy. One priest in particular, Reverend Roger Vietz, wrote of Hugeford in a letter. Vietz was a prominent loyalist clergyman, known for his careful observations and his loyalty to his fellow settlers. He praised Hugeford for his modesty, his faithfulness, and his quiet endurance. According to Vietz, Hugeford never turned away a patient, even when he was sick himself, even when he had no medicine left to give. He simply showed up, with rough hands and tired eyes, with whatever tools he had left in his worn bag, and with a commitment to do whatever he could, even if it meant failure or pain or long hours, into the night. He never asked for thanks, never sought fame. He had already seen enough of the world to know it didn't work that way. Instead, he gave what little he had, his knowledge, his strength, his time. And in Digby, those things were more valuable than gold. But there's something else Vietz observed. He noted that Hugeford, while outwardly calm, carried the burden of remembrance. He never truly let go of what he'd seen: the battlefields, the dead, the children lost to disease, the days when he couldn't feed his own family. It stayed with him, in the way he worked, in the way he spoke, in the long silences between house visits. To most, Peter Hugeford was just an old loyalist doctor. But to those who knew, he was something more: a witness to suffering, and a man who kept walking through it anyway. Digby wasn't glamorous. There were no scientific breakthroughs here, no universities, no newspapers writing headlines. But it was a town of need, and Hugeford filled it, quietly, steadily, and without complaint. Before we move on to the final years of his life, and how history remembers him today, we must understand that in Nova Scotia, Hugeford didn't become famous. He became essential. Before we talk about the end of Peter Hugeford's story, we need to follow him back once more, across the border, to Westchester County, New York. The war was over. The violence had passed, but the scars were permanent. For many loyalists, there was no going back. They were exiled, banished, or simply too afraid to return. But Hugeford, he went back anyway. By the early 1790s, he was an old man, tired, weathered, worn down by decades of service and hardship. But something must have called him back. Something about Westchester, where he had once started as a humble country surgeon. He didn't go back to perform surgeries. Those days were behind him. Instead, he turned to pharmacy. In his final years, Huggeford focused on preparing and dispensing medicines, the safer side of healing, though still far from easy. By then, medicine had begun to change, slowly, painfully, but there was movement. Pharmaceutical knowledge was improving. Some ingredients were better understood, and Huggeford, with all his experience, was the kind of man people still trusted, even if they didn't understand the science. He sold and made tinctures, powders, and ointments. He no longer carried the bone saw or stitched battlefield wounds. Instead, he measured out relief, or tried to, with herbs, roots, and chemicals. But even in peace, life gave him no true rest. In 1792, Elizabeth, his wife, his partner through exile and loss, the mother of their 12 children, died. They had been married for nearly 50 years. She had followed him through war, imprisonment, poverty, and uncertainty. Now she was gone. No letters survive to show how he grieved. No diaries tell us how he coped. But we can guess. A man who had seen so much death likely felt this one most deeply because it wasn't a stranger or a patient this time. It was home. Peter Huggeford lived just 3 more years after her passing. He stayed in Westchester. He kept working. He served quietly, just as he always had. Then, in 1795, he died. There are no dramatic records, no grand obituaries, just a note in history that he passed, and for once, not from violence, not from plague, not on a battlefield, or in chains. He died peacefully, a quiet ending to a long and difficult life. But don't mistake peace for ease. Huggeford's final years may have been calm, but they were hard won. He had lived through the chaos of 18th century medicine, through its surgeries, its poisons, its politics, and its lies. He had raised a dozen children while patching up soldiers. He had been jailed for his loyalties, hunted by neighbors, starved of pay. He had started again in a foreign land, not once, but twice, and through it all, he never stopped healing. Not because it made him rich, not because it made him famous, but because someone had to. Before we explore the legacy he left behind and how medicine remembers figures like him, we must understand Peter Huggeford didn't die a legend. He died a man, but a man who, when history was bleeding, reached for his tools and did what he could. Before we talk about the legacy left behind by Peter Huggeford, we have to understand the world he lived and worked in, because he wasn't the only one trying to heal with what little he had. He was one voice in a crowded, chaotic, often misleading chorus of 18th century medicine. Let's pull the camera back. Let's look at the broader picture. In the towns and port cities of New Brunswick and Nova Scotia, names like William Payne, Samuel Moore, Azor Betts, Thomas Emerson, and the Smith brothers, Nathan and William Howe, were known in small circles. These were trained physicians, some more reputable than others, navigating a medical world still ruled by outdated theory, trial and error, and superstition. Dr. William Payne, for example, was a loyalist like Huggeford. Educated in Harvard and, later in Europe, Payne brought a rare level of formal training back to North America, but even he was limited by the age. The same diseases, The same tools, the same lack of anesthesia, the same trial-based cures. Samuel Moore operated mostly in New Jersey before ending up in Nova Scotia. He was a respected man, but even the best doctors could only guess what was wrong with a patient. They lacked microscopes, blood tests, or even the basic idea of germs. Then there was Dr. Azor Betts, a loyalist who was known more for his political and religious stances than his skill with a scalpel. In fact, he was sometimes seen as part of the problem, another figure selling confidence more than competence. The truth is, quackery was everywhere. It was easy to be a doctor. No licenses, no oversight. All you needed was a convincing accent, a powdered wig, and a few glass bottles filled with herbs, powders, or colored alcohol. People sold snake oil, opium syrups, alcohol tonics, and pills made of lead or arsenic. They made promises they couldn't keep, and people believed them. Why? Because real medicine didn't look that different. Before anesthesia, surgery was screaming and blood. Before sterilization, wounds festered and killed. Before medical training, many real doctors still used leeches, bloodletting, and superstitious rituals to treat the sick. Even legitimate physicians leaned heavily on folk remedies and old wives' tales. If someone had a fever, you might burn herbs in the room or tie garlic to their wrists. If they were melancholic, you might prescribe walking backwards before sunrise. Digestive trouble? Try powdered toad or mercury. These weren't fringe treatments. They were accepted, used, and repeated in towns, cities, battlefields, and backrooms. So, when a man like Huggiford opened his bag of tools, he wasn't working in a vacuum. He was surrounded by dangerous healers, unregulated chemists, and people selling death in bottles. The 18th century was a medical jungle, part science, part theater, part con game. But there was change. Small, slow change. By the late 1700s, a few doctors began questioning the old ways. They started writing down their findings, comparing outcomes, sharing case studies. They learned, slowly, what worked and what didn't. Surgeons like John Hunter in England began teaching hands-on anatomy. Medical journals began to appear. Chemical analysis improved. Hospitals, though still grim, started separating wards and cleaning surfaces. It wasn't enough to call it a revolution yet, but it was a start. And then came 1846, more than 50 years after Huggiford died. A dentist in Boston named William Morton used ether on a patient before surgery. For the first time, someone went under the knife, without screaming, without convulsing, without having to be held down by 4 assistants. Anesthesia had arrived. It changed everything. Suddenly, longer and more careful surgeries became possible. Doctors could work without the ticking clock of pain and panic. Patients didn't pass out or die from shock before the procedure was even finished. From that point on, medicine moved faster. It improved faster. And the barbaric images of 18th century surgery, the bloody aprons, the piles of limbs, the gut-wrenching screams, began to fade. But Huggiford never saw that world, nor did Payne, nor Betts, nor Moore. They were stuck in the transitional age, a time when medicine was trying to grow up but didn't yet have the tools. And in that world, a good surgeon wasn't someone who could cure everything. It was someone who tried anyway, someone who stood in the blood, heard the screams, and didn't turn away. Someone like Huggaford. Before we close the story, there's one last thing to reflect on. Not just the facts of his life, but the reason they matter. Before we talk about the legacy of 18th century surgery, we have to talk about how absolutely miserable it was to be a surgeon in the first place. Because it didn't just suck, it was terrifying, it was gruesome, it was lonely, and it was nothing like the way we think about doctors today. Surgeons in the 1700s weren't heroes in white coats. They weren't figures of respect in clean hospitals. They were often viewed as butchers, literal knife men, covered in blood, with trembling hands, standing in dark rooms, filled with screams. Let's start with the basics. There were no painkillers, none, no morphine, no anesthesia, not even alcohol strong enough to knock someone out reliably. When someone went under the knife for a bullet wound, a shattered leg, an infected tooth, they were awake. They felt everything, every slice, every pull, every second of burning, tearing, scraping pain. Surgeons often needed assistance to hold the patient down because the body would thrash violently. And if it didn't, that usually meant the person had gone into shock or died before the surgery even finished. Now imagine doing that day after day. This wasn't just physically hard, it was mentally unbearable. You could never forget the look in someone's eyes right before you started. You couldn't unhear the screams. You couldn't forget the smell of burning flesh, the crack of a bone saw, or the aftermath of a failed procedure. That's the second part. There were no antibiotics. So, if you cut someone open to save their life, there was a high chance they'd die anyway. Infections were almost guaranteed. Gangrene set in fast, and once it did, there was little a surgeon could do except amputate more or wait for the inevitable. No antiseptics either. They didn't clean their tools between patients. They didn't wash their hands. The same rag might be used on 5 wounds. Knives might go from one body to another without even being wiped. They didn't know germs existed, so they carried death from patient to patient, even when their intentions were pure. Imagine how powerless that made you feel, to work all day trying to help and still have your patients die one after another. No medals, no thanks, no applause, just death, blame, and grief. And pay, hardly worth mentioning. Surgeons were often underpaid, especially those like Peter Huggaford, working with poor communities or in war zones. They had families to feed, rent to pay, and yet they were expected to perform miracles in back rooms and on battlefields for next to nothing. Most never made a name for themselves. Most never published books. They just worked and then faded into history. And while we're on the topic of emotional toll, think about this. There was no mental health training, no trauma counseling, no way to process the horrors they saw. One historian, René Fulop Miller, described it best. He said the psychological damage done to surgeons was invisible but permanent. Many spent the end of their careers broken, haunted, or bitter. Some doctors dealt with it by disconnecting completely. They stopped caring, stopped feeling. Others became cold, cruel, even sadistic, because that was easier than empathy, easier than feeling the weight of every child that died in their arms, every mother they couldn't save, every soldier who bled out while begging for help. And society didn't exactly respect them for trying. Back then, physicians, men who diagnosed and prescribed, were seen as educated. Surgeons, they were tradesmen, craftsmen, mechanics of the human body. They worked with their hands, and they got dirty doing it. So people often looked down on them. Even when they were saving lives, they were whispered about, avoided, sometimes feared. Now compare that to today. Modern surgeons work in clean, well-lit operating rooms. They have teams, machines, sterile gloves, digital monitors. They use scalpels that cost hundreds of dollars. They can operate with robotic arms. They have access to drugs that control pain, manage bleeding, prevent infection, and help patients recover faster. They're paid well, respected, admired. That doesn't make the job easy. Surgery is still one of the most demanding fields, but the gap between now and then is like night and day. 8th century surgeons were walking a tightrope blindfolded. Every patient was a gamble, every procedure a coin toss, and yet many still showed up, still learned, still tried. People like Huggerford didn't have the luxury of modern tools or recognition, but they had courage, a kind of brutal, quiet courage. And that might be the one thing that hasn't changed, then or now. Before we finish tonight, let's return one last time to Peter Huggerford. He wasn't famous. He didn't invent anything. There are no statues, no hospitals with his name, but he was there, in the mud, in the blood, on cold floors and smoky fields, serving the broken when almost no one else would. He stitched wounds in silence. He treated the poor for free. He buried patients he couldn't save. And still, he kept going, a loyalist, a refugee, a father, a surgeon without painkillers, training, or peace. He moved from New York to Nova Scotia and back again, not for fame, but to survive and to do his best with what little he had. Peter's story reminds us of something important, how very far we've come. Today, a child can have life-saving surgery and go home in days. We have vaccines, x-rays, anesthesia, and antibiotics. We've unlocked the mysteries of the heart, the brain, even DNA. But back then, doctors worked in the dark, literally and metaphorically. They didn't know what caused infections. They didn't know how to stop pain. They just tried. And many, like Huggerford, suffered quietly so others might heal. Tonight's story wasn't thrilling. It wasn't filled with action or heroes or romance, but it was real. It was honest. And sometimes that's all history needs to be, because the past doesn't always shout. Sometimes it just whispers through dusty journals, yellowed letters, and forgotten names. We don't tell these stories to entertain. We tell them to remember. So to every surgeon who worked without hope of success, to every patient who suffered without understanding why. To every family that lost, waited, or simply endured, we say thank you. And to you, lying in bed, eyes closed, maybe already drifting, we hope this slow story helped you rest, helped you escape for just a little while, and reminded you that history was never meant to be exciting. It was meant to be remembered. Sleep well, and if you enjoyed this quiet journey through the darker corners of the past, please like this video and subscribe to our channel, Restless Historian. We've got more stories to tell. Not loud ones, not glamorous ones, but slow, strange, human ones. Good night.